I would like to present about the first topic regarding the case report and literature review. So firstly, I believe all of us already familiar with this type of pyramid. It illustrates a strength of evidence for each type of study. As the study goes higher, located higher in the pyramid, it means the study have the strongest evidence. And regarding to our topic, which is about the case report, sadly, it is located quite at the bottom of the pyramid. It means that the case report evidence is not strong enough. Firstly, the definition of case report itself is about a detailed report regarding the symptoms or sign or diagnosis or treatment or even follow-up of an individual patient. Usually we write case report if we encounter an unusual case in the clinic. And then clinician usually likes to write case report because it is a rapid communication in between their tight schedule. However, recently we already learned about this as well. There is a kind of newest type of case report. It is called the evidence-based case report. I will elaborate more about this in the next slide. There are some reasons why we publish a case report. Because the first one, we meet an uncommon cases in the clinic, and then we do not know what to do with the patient with that cases. And then also the cases we think might elaborate a new theory. That's why we write the case report. The case report itself is contained of several structures. Started from the abstract and then introduction, continue with the case itself, and then we discuss the case, and we close it with the notes and references. This is the example of case report that I found in the Journal of Plastic Reconstructive Surgery. This case report contains of the previous structure, started from the abstract or the summary, and then the introduction regarding the background of the cases, including the epidemiology, and then the case itself, and then we discuss the case, and close with the notes and the references. To write a good case report, usually we use a guidelines. This is one example of the guidelines. It's called SCARE, or Surgical Case Report. It contains a detailed point which should we put in the case report, starting from the title, and then the abstract, also the intervention also, and lastly, can contain about the patient perspective. However, this is only one example of the guidelines. There are many of them out there, but to choose which one should we use, it depends again to the publisher or the journals that we want to submit our case report into. And then we back to the newest type of case report that I've mentioned before, the EBCR, or evidence-based case report. It is based on the evidence-based medicine. This is usually start when we meet the patient with the problem or unusual cases in the clinic. And then we want to know what is best for the patient or what is happening to the patient. We can formulate the questions from that. And then from that question, we search the evidence from the previous writings in the databases such as PubMed, Scopus, etc. Those evidence then we critically appraise. It means that we want to know this previous writing is valid or not, it is important or not, or applicable or not. If this evidence that we found is already critically appraised, the chosen evidence then we put into our EBCR, Then we can publish it and apply the evidence. The contents of EBCR itself is quite different from the case report. It mostly the structure of case report is included in EBCR, but one of the difference is EBCR contains search strategy and also the critically appraised evidence that we found before. So it is quite more reliable than the case report, because case report only mention about the discussion, but doesn't mention about the past writing that they use. This is the outline difference between the old-fashioned case report and the EBCR. EBCR, as I said before, it is searching the evidence and with the critically appraised. So it is more focused discussion. And then when we meet the patient, usually we formulate the clinical question based on the PICO. PICO is the patient intervention, control, and outcomes. So it is more focused, and the discussion will be more better than the old-fashioned case report. And then we move on to the next topic, which is about the literature review. Literature review is writings that provide critical assessment of the literatures or the evidence that we have collected before. It helps to identify a gap in our research, and then we should also critically appraise the evidence that we found and then summarize to prevent the plagiarism. This is the principles to write a literature review. It should be well structured. The ideas should flow logically and systematically. The evidence or the past writing that we use, it should be current, about 10 years from now. And then the terminology and viewpoint should be clear. And we also, again, critically appraise the evidence by applying the VIA, or validity, importance, and applicable. This is the components of literature review. The aim, why we write the literature review, the title itself, PICO, and then the problem that we might encounter, and then the variables, dependent and independent, if there is any, and how those variables relate to each other. How to write? First, again, start with the clinical question. And then we search for the evidence in the databases, and we appraise the evidence to check whether it is valid, important, or applicable. If the evidence is fulfill the critically appraised criteria, we can apply it in the writing. I guess that's all from me. Thank you, Doctor and friends.
Okay, so I think you covered the two topics in regards of case report and also the literature review. And I think it's okay, but before we opened the sessions into open discussions for all the attendants in the sessions, I would welcome you to go into the detail of the scare, because this is very specific for surgical case report, in which, in my best understanding, this is a kind of elaborations from the care guide, which mainly is for the general case report, but with S in front of the care is intended specifically for surgery. So beside going into the detail, you also point the aspect where it becomes very specific for surgery case, so that your peers would identify and learn something better. Okay, Mevitra?
Yes, Doctor. So this is the SCARE guidelines to write the case report, particularly in the surgical cases. Sorry. The first thing is about the title. The area that the clinical question that we want to know should appear in the title. Either whether it is the diagnosis that we want to know, the presentation of the uncommon cases, the surgical techniques, or the device. And then we should also put the keywords here. 3 to 6 keywords is enough. And then about the abstract. Abstract should contain 4 main structure. The introduction, the patient important clinical findings, the main diagnosis or intervention or outcomes from the patient, and then also the conclusion, what we can get from this case. And then we go deeper into the introduction. This is usually the background about the case. Usually we use references. 1 to 2 paragraphs is enough. And then we move on to the cases itself about the patient information. First, we should identify the demographic or other specific information, including age, sex, ethnicity, occupation that might contribute to the patient condition. And the next one is about the complaint of the patient. Next, we move to the past medical or surgical history. And then the last one, from the drug history, family history that might relevant to the cases. After the cases, we move to the clinical findings. This is the objective findings that the doctor might find, including the photograph or another laboratory result. And after that, after the findings, additional findings, we move on to the timeline. Actually, this is, I found it the same doctor with the patient cases because it retell the story about what happened to the patient from the start until the patient coming to us. And then we move on to diagnosis assessment, including the method, what we do to the patient, whether it is physical exam, laboratory, or etc. And then what we might found when we are doing the diagnostic, whether it is financial or access to the test. And then the HC is why we're doing that kind of diagnostic. And the last one is the prognostic characteristic if, for example, the tumor staging. After diagnostic assessment, we move on to the therapeutic intervention. This is kind of management what we do to the patient. 9A is pre-intervention consideration. Before we do the intervention, what we do to the patient. The 9B is type of intervention. 9C is what we do in the middle of intervention, why we're doing it. And then we also should explain who performed the procedure and why we're doing that with the procedure, the reason behind that. And then we also should evaluate after we give the procedure or management. After all of that, we should follow the patient, which is on the point 10A. We assess, and then we write the report. And we also should provide a photograph or radiological image in the report. Okay, the importance of the follow-up should also be put in the report. Any complication or adverse event also. And then we move on to the discussion. All of that that we stated should be put in the discussion, the strength and weakness and limitation. And then we trace back to the previous study, which one is the same with us, which one is different, and why is that difference. And then we move on to the patient perspective after the discussion. We should ask the patient regarding their perspective on this management that they receive. And then this one, informed consent, should be put in the note section about the informed consent given. And then the last one is additional information like conflicts of interest, funding, and institutional review board. That's all, Dr.
Okay, good. Thank you. I think you have presented in detail so that the audience would understand better. And now it's welcome. I welcome you to, all of you to discuss the topics on case report as well as the literature review.
Yes, doctor.
Yes, please.
I want to ask about the advantages of conducting the literature review, doctor, because compared to systematic review that nowadays is more common to more common to do. What is the advantages? What are the advantages of doing literature review? Because it usually only narrative review, I think. So can you please explain about that? Thank you.
Good questions, Adlina. Yes, it's back to Mayvita, and I would welcome the others also to support the response for Mayvita. Mayvita.
Okay, Doc. What I get is that literature review is not a standalone structure. It is part of a manuscript or even to support our submitted journal or writings. If literature review help us to found the background and help us also to talk in the discussion part later on, because it gives us perspective on we how should we do with the case, and also uh, I guess it is not a standalone part, doctor.
Okay, so you responded properly. And on the other hand, Adlina was questioning whether this literature review is also part of type of publications. Whether this kind of literature review is eligible for publications. And she also mentions this might be classified as narrative review instead of taking the chance for us to embark into the highest evidence-based medicine with a systematic review. So I welcome any other to give response. So Adlina was questioning whether this type of literature review is still given room for publication.
May I try to answer it, though?
Yourself? Okay.
Because literature review doesn't contain analyzation of the evidence, while systematic
Analysis.
review,
What is analyzation? So making anal?
we don't analyze. Sorry, doc. We don't analyze the previous evidence. We only summarize the previous evidence in a paragraph. While systematic review, we do the analyze, and then we do the forest plot, etc.
Okay. Adlina, I think you are correct that now the room for literature review for publication is very low and becomes very rare for scientific community to publish literature review unless specific journal invites expert to come with literature review based on his experiences. I think this kind of invitation is just like public lecture that comes as literature review and not with specific methodology like when people embark into writing on systematic review. But on the other hand, as you may recall, the early slide that Mayvita presented, literature review may still have room if you or whoever have the interest with the writing is providing the readers or public with critical appraisal of specific topics or critical appraisal of certain research that come into a new formulations that in my understanding this formulation could be like preemptive hypothesis. So the old paradigm of writing narrative review, which in my own language I call it as tinjuan pustaka suka-suka, meaning that we only take references that we could reach or we could get the access, and also we kind like cherry picking with the literature with the references because we want to get support of our idea. So we are kind like neglecting the statement from other references that may contradict with the topic that we are writing on. So that narrative review is no longer have a spacious place in the publications. So that's why this applies only for even for reputable journals to invite experts to come with this kind of literature review. So I understand the training program in our university, specifically with the general surgery, still gave you chance to write paper based on literature review, which is, in my observations, quite confusing because you are given the chance to write literature review, but you have to start with proposal and also with the methodology. This sort of thing is not really supporting to the fact with the current situations in regards of scientific publications, but because that's policy from the training program, so I cannot say that I would neglect this area. Maybe this is just because the training program gave this chance just for learning session or learning experience for you to write literature review. We are happy to see that Mayvita comes with some information based on the previous MKDU, MKDK lecture by the expert of writing, that writing literature review, which is basically narrative review, needs also to be with critical thinking. At least when you pick references, you need to come with the appliances of the concept of VIA, the validity, the importance, and also the applicability. So when you refer into those VIA, it means that you need to start with problems or even with case. So this kind of concept may also be good for you to not only cherry picking the literatures, but also try to be critical, appraising the references that you use. All right? Hopefully that Adlina is satisfied with our discussions responding to her inquiry. Okay, now I welcome others to come with questions.
Sorry, sir. May I have your permission to ask questions, sir?
For sure, Aditya, welcome.
Okay. Actually, I would like to elaborate on Adlina's question, sir, because I'm still confused, actually. So if we refer to the EBM's pyramid, where can we actually find the EBCR or the evidence-based case report? Is it equal to a case report or a literature review or a narrative review, which is essentially reporting a case without certain guidelines, unlike the systematic review, or is it below or even equal to systematic review, since the EBCR uses systematic searching, selection, and appraisal techniques? Thank you very much, sir.
Thank you, Aditya. Now it's back to Mevita.
May I share my screen once again, Doctor, to show the
Yes,
pyramid?
you're welcome.
So, in this pyramid, I show this part, the critically appraised individual articles. I think the EBCR will sit in here. So it is quite below the systematic review, but not at the bottom of the pyramid. So the evidence is quite strong.
Okay, that's the standpoint where Mevita understand with the positions of the EBCR. Now I welcome the others. What about your opinion?
Good morning, sir. My name is Jonathan from Cardiothoracic and Vascular Surgery Department.
Yes, Jonathan.
Yeah, I do agree with Mevita's statement that the EBCR is on the pyramid level of evidence medicine. It's on the same. It's on the just below the systematic review, only if it's done correctly. And narrative review or literature review is, I think, it's below the case series or case report, since on my personal opinion, the literature review is not a higher form of evidence level medicine. It doesn't prove anything. I think it should be written more as an idea, not where there's an original article available and that it could be followed by a research in a later time, such as when in time of COVID here, when there's not enough supporting evidence found, but there's an urge or needs to publish ideas which could be bridged to research later, then there's a portion, there's a place for literature review. So I think the literature review is under or below the case control, or case report or case series. Thank you, sir.
Thank you, Jonathan. All right. So just to make it clear that Jonathan picked the current situations, pointing into the importance or the place for literature review. But so far, literature review is not really mentioned in the general concept of evidence-based medicine. It's away from the pyramid of evidence-based medicine, because
yes, sir.
Evidence-based medicine comes as research. Okay, but
yes, sir.
In the very scarcity or scarce, it's in a very specific where we see very rare evidence, then this literature review have room, like with this current pandemic, in the early or in the beginning timing of the pandemic, where people start to communicate by publishing their opinion. So even opinion comes not as a literature review. So in my own personal point of view, that those two types, opinion is kind of like editorial writings, it's opinion from the editors, and also opinion from expert in the form of literature review. It's just at the lowest position as expert opinion.
Yes,
when
sir.
you communicate to a professor or a very noted scientist, and they or he or she come with very specific opinion, but based on their own personal experiences, then it comes as expert opinion. So when you join word round, for example, an expert in that specific word round tells you something that you need to use this specific catheter. But when you refer into literature, it does not exist that way. But the real practice in that specific center, like, for example, in your division, use that or practicing that specific device or catheter, for example, then it is at the level of expert opinion. So this is the lowest part. Okay, but generally speaking, literature review is not listed as uh, the lowest part of the evidence. But when there is no other evidence that we could refer to, then this literature review may be used for scientific community to refer to. So back into the EBCR, I would like to welcome, one more from the class. If you have any idea to tell, what's the level of this EBCR? Because Mevita and Jonathan agree that this EBCR is quite high in terms of its position. They mention it's just below the level of systematic review. Well, that's very high. I got the information just by at glance. It's even higher than RCT. Hopefully, I'm wrong.
Yes, sir.
Yes.
Yes. In my humble opinion, I think I'm a bit confused, or I'm a bit in the middle of between if the EBCR would take place in just below systematic review, or it is below or equal to case reports, because in EBCR we usually start the paper with a case of a patient for an illustration, and then we further try to elaborate or explore the evidence about the patient. So I'm a bit confused if it is placed underneath the systematic review or the case reports.
Okay, so you do not have answer or respond in terms of your stance or your understanding to respond to the positions of the EBCR. All right, thank you, Eva. All right, so let me just take the response. EBCR still has the CR. CR stands for case report. So there is no point to take this CR higher than the level of case report itself. Sadly speaking, the initiations by the group of experts that started to introduce this EBCR through the publications in BMG at the late 90s was not really given rooms by many journals, specifically with the reputable international journal. They don't really give space for EBCR to be taken into their publications. And even in my personal experience, many journals do not recognize this EBCR, so they kind of like see it weird. What kind of writings of this EBCR, because we do not see the place for case report, but we do not see also the place for other level of evidence-based medicine. So I got also experience that EBCR is not given the spacious room in the international publications. However, it's very good to know that EBCR is more structuralized compared to the classical or very traditional case report, because you are invited to go through a more methodological way of critically appraising the references when you present the case. But one weak point that I've observed with this EBCR, that the case may not be a real case presented, which is very different with a real classical case report. So with this standpoint, I see that the EBCR is a way to give you experience to learn literature review by good critical appraising technique to come into answer for your previous formulations of answerable questions. You got it? Yeah, By
Got
the EBCR, you are invited to make a formula through questions that comes or that follows the PICO concept, the PICO concept. But again, the level is just case report. If you got the acceptance with your EBCR, you are just lucky, or you are a good picker by targeting specific journal that still accept case reports. But nowadays, we also observe, or we also see that publishers also comes with specific journal that is dedicated for case report. So that's the point where you would like to submit your case report. You can go through that specific journal. A case report would still be given space in reputable journals, where the journal usually do not take case report if the case report is reporting a real breakthrough of something in medicine, or a case in medicine. Not something, of course, a case in medicine. All right, so I think that's enough for the discussions on this case report. I would like to bring you a little bit on the literature review. If any of you would like to elaborate more, one or two questions would be good.
Doctor, may I ask another question about this topic?
Sure.
Yeah, I want to ask about the guideline for reporting or writing the manuscript of literature review, because in some resources that I've searched, I cannot find the reporting guideline or guideline to write the manuscript of this kind of review. Could you please explain or let me know where I can get that guideline? Thank you, sir.
Okay, thank you. I think because Mayvita has spent lots of time and energy to prepare her presentations, now I would ask for the chance to call a friend.
Maybe Erin Mariam.
Oh, okay, Erin.
Yes.
Erin, don't get mad to Mayvita.
No, sir, I don't get
Awas
it.
lo ya, gitu. Gak tak traktir bakso lo. Walah, kalau Mayvita bilang, kalau cuma bakso sih, Kak UU, emang gue pikirin gitu ya. Traktirannya mesti more eligible gitu. Yes, Erin.
Yes, so from what I've been searching in the previous model, I think we can find the guideline at PubMed, or by probably simply Google the kind of guideline that we want to search, and it appear and it will direct us to PubMed. Sir.
Okay, so just want to clarify the questions from Adlina. Adlina was asking for guide in terms of publishing literature review. It's not the way to find the guide.
I think if is it how we write about regarding how we write the literature in one specific or particular journal?
It can be general. If you could refer to one specific journal, you're welcome. But the question comes as a general question.
Because
may I help? Maybe
it depends on
Jonathan. Erin is excited to give you a response.
all right, so thank you, sir.
Okay, Erin.
I think it depends. It depends on each journal. If Adlina is asking for the specific technical guideline for publication, because it will be different, sir.
No. I think you don't get our discussions. The discussion is to respond to the questions that Adlina asked in regards of what guideline we can use to guide us with the writing of literature review. of course, to be eligible for publication. So, okay, Erin, what do you know about the guide to help you publish RCT, randomized clinical trial? Okay, what about systematic review? What guideline or guide that you could use to publish systematic review?
If I'm not mistaken, for RCT is consort, doctor.
Okay.
Yeah.
And what about systematic review?
For systematic review is Prism.
Prisma, not Prism.
Prisma.
Prism is like Priya Prism? No.
No, Prisma.
Prisma. Now, the question comes similar. In the same level, what is the guide for literature review? Itu loh, kok angel tenan nah? Ini bahasa Prancis nih, angel tenan itu bahasa Prancis. Atau nggak setuju itu? Bahasa Armenia ya? Biarin.
I think in Ecuador, there hasn't been the guideline for literature review, doctor.
Okay, so that's the answer from Erin for Adlina. Now we have Jonathan to help us.
Okay. Yeah, I do agree with Erin as well that I haven't found any guidelines about publications, guideline publications, and for literature review. But with Google that I just did earlier, I found the SANRA. May I probably share screen, sir? Or
Yes.
this is what I found. It's a SANRA, a scale for the quality assessment of narrative review articles. I hope I haven't read the whole articles, but maybe I hope that this could answer the Adlina's questions earlier. So yes, this article found that SANRA's visibility, interreliability, homogeneity, and internal consistency are sufficient. And the checklist is explained here. It comes with 6 different questions about justification of the article, importance of the readership, statement of concrete aims of formulation questions, description of the literature research, referencing, scientific reasoning, appropriate presenting of data. Yeah, maybe that's all that I could help, sir.
Good, Jonathan. So now you may share it to the audience if you could get the PDF so that others would enjoy your generosity. Okay, very good. But Erin was correct that in general, we do not follow, I mean, many journals do not follow the guide for literature review because mostly journals do no longer accept literature review in the form of narrative review. Mostly are welcoming systematic review. And if it comes as narrative review, some good journal in the high-ranked reputable journals, they invite expert. So meaning that narrative review is just based on the invitation. Got it? Even if you see Q1 level of review journals, for example, in the musculoskeletal system, we got quite high-ranked journal. It's all about review, but you have to know that the reviews are only based on invitation. So it does not open the narrative review submitted by common or by public without invitation. But you can try, if you think that you come with a very good idea with your narrative review or critical review or whatever, as long as this is not systematic review, you could give like brief report to the journal and then the editor would review it briefly whether you are given grant to submit your work with this type of critical narrative review. But it's not a common practice. Mostly, journals do not accept this kind of literature review that is not classified as systematic review. But yes, still exists. Some journal takes this type of narrative review. Okay? So later on, I would invite you to discuss with your supervisor if you are given the chance to submit proposal for your writing, for your scientific work with this kind of review. I think I would welcome you to come with systematic review, but please understand that systematic review are not good to be written given only your limited time in 1 month. No. That's not a good idea, because we understand, in only 1 month you work for your systematic review, it's useless. We understand that, your effort would be just going through abstract, and that is not the correct process of writing systematic review. I understand that you were given the lecture about systematic review, and the process is very lengthy because you need to get full paper and you need to assess critically every single paper. For example, if you kind of like setting up list of abstracts, list of keywords, and then if you put into the system of the search engine into the database sources, then you may end up with thousands of papers or hundreds of paper. There is no point for you to just work in a week and then you come with full report of your systematic review. I would say in bahasa Belanda, the systematic review is considered as systematic review ecek-ecek, meaning that kami nggak bisa percaya gitu. Bagaimana Anda bekerja seorang diri systematic review hanya dalam tempo singkat, lalu datang dengan report yang meyakinkan. Biasanya kalau itu memang benar terjadi, super lucky, sangat beruntung, atau pekerjaan Anda itu GOMBAL. Kenal ya Erin ya? GOMBAL?
Ya dok.
Kenal ya? Gombal. Jarang ada orang bernama Gombal, jadi Anda mestinya nggak kenal sih. Okay, so I think it's enough for now. Thank you for being active and also being interactive with this session.